Hello, everybody. Diabetes is moving into the space of digitalization, and then there are a lot of technological advances that are helping not only the doctors but also the patients. It is time that we also move with what is available to us in the technology to better take care of our diabetes. In fact, I was talking to Srimati Chandrika, I was explaining to her as a patient, the doctor will see maybe for about 15 minutes during each visit. This may happen about 4 times a year or maybe a little longer. So you have hardly spent about 1 to 2 hours of your time with your healthcare provider. When once you're back, you have to take care of your diabetes. You may be taking insulin, you may not be taking insulin. But what is important is a structured self monitoring of blood glucose. In fact, this is where the digitalization has taken a big role. Earlier, people would check their blood glucose values, they would write it down on a piece of paper. It was never structured, number one. Number two, the values were not clearly written. The doctors were not getting the values on time. And the doctors would never know at what time these blood glucose values have been done and what is the relationship of that particular blood glucose value to a meal pattern and what meals you had. So there were a lot of difficulties. In fact, during the COVID era, a number of apps got introduced in the Indian market, especially the apps which could actually track the blood glucose values. You could put in the data of what you've actually eaten into your app so that the doctor can actually trace it. In fact, somebody asked me, what are the digital applications that are there to help a patient with diabetes? In fact, I will just list out a few of these things. You have diabetes data management platforms which were there earlier but not really available now. You have telehealth services which used to be there. Many companies have tried this, which hasn't really worked out, where the patient has to call up a particular person and then talk about the problems. This hasn't helped out. There are digital prevention programs, a number of them actually were advertised, but then they really did not take off. Mobile applications, of course, I think that's an important thing that we'll be talking about. Then you also have social media coverage of patient education, cloud based digital monitoring of some of the glucometers. I think the most important thing, which is cost effective, which every patient can do, very easy to understand, is going to be the mobile app. And my focus will be on the mobile app, especially the My Sugar app and the AccuCheck glucometers that are actually helping out. Now, how is it beneficial? Now, most importantly, if you have an AccuCheck glucometer, you can actually sync it with the AccuCheck glucometer. It will track your blood glucose values every time you do a blood glucose value using the Bluetooth technology. It will be in your app. It will tell you at what time this blood glucose values has been recorded. You can also fill in the details of the food that you have taken. Now, when you do this continuously for a week or 2 weeks or 3 weeks, whether you are being asked to do it 2 times a week or 3 times a week or 3 times a day, depending on what your doctor has advised, the doctor can also get the access to this particular data. Now, this is where this technology has become a big boon, and especially during the COVID days, we would actually tell the patients, put in the data of the food that you have taken and please give us the data of the blood glucose values. You can be doing it at home. I will watch it on my system. And this data is fully protected and the patient has the right to give the data. Now, when you are taking insulin, you are actually told and taught by the doctor how to adjust your insulin dosage. And that is something that you can always do. And as a doctor, when I'm looking at your data from the other side, it becomes very easy for me to know what food you have taken and how the blood glucose values have actually fluctuated over a period of time. And then over a simple telephone call, I should be able to immediately tell you how to adjust your insulin dosage. So it becomes a very personalized diabetes care. We call it the iPDM platform, where you're checking the blood sugars at home. You're being educated once in the clinic, and when you check in the blood glucose, the values from the AccuCheck actually goes into your app, and these values can be seen over a period of time. Plus, there is a lot of data. It is not only helping the patients, trust me, it is also helping the doctors to do a lot of research. So, digitalization is there to stay. We have to adopt it, adjust to that. Both as doctors and as patients, My Sugar app can be used free of cost by most of the patients. When you buy an AccuCheck meter, please ask for the My Sugar app. That will be downloaded free of cost and given to you by your doctor. Thank you so very much.
Hello, welcome to Rang De Neela. I'm Dr. Usha Ayyagari. I'm a Senior Consultant Endocrinologist in Chennai, practicing in Tamil Nadu. Today we're going to talk a little about diabetes. With diabetes, we know that not every individual is on the same medication. We know that not every individual has the same control or the same lifestyle or the same patterns. So if I give you the example of a young 45-year-old lady who's had type 1 diabetes for 25 years and is currently on basal insulin and mealtime insulin, so what we call prandial insulin. Now, her blood glucose may show various patterns. However, within those patterns, we have to recognize where it is going well, where it is going wrong, and fix it. It becomes even more important if such an individual should have other complications like micro or macrovascular complications, because as we know, glycemic variability, peaks and troughs also affect control. When we look at blood glucose patterns, we look at four main areas. We look at whether this is high, hyperglycemia, lows, hypoglycemia, whether it's in the fasting state, whether it's between meals or postprandially. In certain situations, for example, you could see patterns that suggest that there is a post-meal hyperglycemia. But if we keep on increasing the insulin, we may face hypoglycemia either post that meal or in between meals. To identify the patterns, we obviously need to look at potential causes. So when we look at causes, is this a mismatch between food and insulin? Is this too much insulin at mealtime? Is the correction dose that they're taking too high? Are they taking correction doses in between meals? If the hypoglycemia is overnight or in the fasting state, is the dose of basal insulin correct? Is this something that we need to fix? So once we identify the patterns of hyper and hypoglycemia, and whether it's in the fed state or the fasting state, we really need to look at which insulin is mismatching and what we need to fix to get rid of these fluctuations. So for example, in a type 1, we may have to look at if it's a post-meal hypoglycemia. Are they using carb counting, or are they using any kind of a method to estimate the amount of insulin they need to take at mealtime? If their pre-meal insulin levels are less than ideal, what is the correction dose that they're using? Is that something that we need to fix? And for example, if the hypoglycemia or fluctuations are say pre-dinner or overnight, we need to identify and adjust the basal insulin as we've discussed. We have various patient education materials that we can use. We have, for example, books that can teach carbohydrate counting. We have apps that they can input the data into by portion size or by weight, and they will give out the carbohydrate amount. We have various online courses that we can appoint type 1 individuals to, that they can learn more in terms of managing the type 1 diabetes. Equally, if you have a dietitian or a diabetes nurse in clinic, they can help guide the patient by looking at their portion sizes and by looking at their carbohydrate estimation. Of course, when we start insulin, it's very important to teach the people on insulin about how to recognize and how to manage hypoglycemia. That's one of the most important things. If despite doing all this, we still face challenges, then we go back to the basics. We start looking at the kit, the insulin, the pens, whatever they're using to inject, their CBG meters, their injection sites, their injection technique, and go back to basics of looking at their CBG patterns and recognizing where the deficiencies lie. So, taking a systematic approach actually helps us to identify which individuals are at high risk of hypoglycemia, and it also helps us to identify the risk factors for hypoglycemia. As I've briefly discussed, is it an insulin carbohydrate mismatch? Is it overcorrection? Is it the untimely dosing of insulin? And once we identify these risk patterns, we can educate the patients on how to manage these. When we are looking at pattern analysis, let's understand that random self-monitored blood glucose or CBG gives us very little value. But if we undertake structured SMBG, so for example, if you look at fasting and pre-dinner readings to understand your basal requirements, if you look at 2-hour post-meal values to understand the prandial insulin dosage, if you undertake 3-point, 7-point, 5-point, and if you undertake 2 a.m. readings to understand nocturnal hypoglycemia, a structured approach gives you much more information than doing random blood tests here and there, which will not really give you a true understanding of the pattern. If despite a structured approach we don't have enough information or we are still doubtful, of course the CGMS or an AGP can add additional information. So structured SMBG has much more value in identifying patterns. Now, SMBG can also be used for patient education. When you put a pattern in front of them and explain to them how exercise, how a given amount of carbohydrate intake, how a given meal influences their glucose excursions, you can see almost a light bulb moment where the patient realizes that this is the change that they need to make. So a structured SMBG has value to us as a clinician to improve the glycemic control and to understand the patient patterns, but equally it has great value to the individual living with type 1 diabetes because it gives them an understanding of their own diabetes, of their own excursions and patterns, and leads to self-motivated behavioral change. When we work with the diabetes care team and the individual living with diabetes, looking at structured SMBG can help us improve outcomes. It improves patient satisfaction, it improves glycemic control, it can minimize the risk of hypoglycemia, and it engages the patient and makes them a true active participant in their care. Other things that can help when you're looking at structured SMBG is to record exercise, to keep a food diary, so that if you look at hypoglycemia or excursions, you can understand what is leading to these patterns. So what I'd like to conclude on is that SMBG is very valuable, but random testing adds very little value to the patient or to the clinician looking at managing diabetes, whereas undertaking structured SMBG in an individual using insulin allows you to recognize patterns, recognize trouble areas, whether they're hyper or hypoglycemia, correlate these patterns with exercise, meal timings, meal content, and the individual's lifestyle. And it helps you as a clinician to improve outcomes, but it engages the individual living with type 1 diabetes. It improves their knowledge and it helps them become more autonomous in managing their diabetes. He says that there are many challenges. At present, people just treat it as it's only mud made. But what he says is that terracotta is a fine art, honed over centuries, honed since the beginning of time. And they want to bring this awareness to the people so that there is a value on their art, so that they don't need to struggle to make a living. So he's very keen to bring out all the nuances of terracotta so that we appreciate the stages, the processes, the difficulty, the skill involved in this, and so that we all learn to support the artisans and the artisans in their livelihood.
Hello, good evening. Today we are going to discuss about monitoring of diabetes with the available tools. Well, so we have treated the patients with type 2 diabetes with lifestyle modifications, medications. Then what? The point is that treating diabetes is not complete unless you monitor your patient and bring the HbA1c to the target level. Now, while to bring the HbA1c to the target level, patient needs a close-up monitoring. As we all know, we measure HbA1c at every 3-month interval. What to do between the 3-month interval of time to bring down the HbA1c to target of less than 7%. We have a variety of tools today, starting from self-monitoring of blood glucose. At home, you can measure your blood glucose. We have different ways of continuous monitoring of blood glucose. That is a little bit of intensive. However, the most comfortable way to monitor diabetes in today's world is the high-class glucometer available. One can measure blood glucose at home with the help of a glucometer. I'm not going to the details of principles of different glucometer available at the moment in India. As you all know, the modern glucometer gives you almost a calculated blood glucose value, which will be pretty similar to what you measure from the laboratory. Let me remind you that although glucometer may have a variation of 10 to 15% of blood glucose, because you are measuring the capillary blood glucose, while laboratory measures the either whole blood glucose or plasma blood glucose through the venous blood. But one point I would like to reiterate here, that fasting blood glucose through a glucometer or through a venous blood sampling is almost similar, exactly similar. The difference lies in the prandial blood glucose. There can be some delay in the blood glucose value in the capillary. Normally, capillary blood glucose overestimates the prandial blood glucose. In particular, there is data to suggest that capillary blood glucose is little different 30 to 60 minutes after the meal compared to the venous plasma glucose, but fasting blood glucose is almost same as of the glucometer compared to whole blood venous glucose. Therefore, many patients ask me, especially during the COVID time, doctor, I don't want to go to the laboratory because of the COVID pandemic. So can I do it at home? Yes, you can do it. Absolutely. The today's glucometer gives you almost a similar value as of the laboratory value. In particular, the fasting glucose measured through a glucometer is almost same as of the venous blood glucose drawn from the vein and tested in the laboratory. Now, there are some ifs and buts while you are measuring blood glucose through glucometer, and one has to be very careful. Although the self-monitoring of blood glucose is very important, today we have got integrated personalized diabetes management, we call iPDM, and with the help of glucometer and with the help of your mobile phone, there is an app, you can integrate your blood value of your glucometer and you can integrate into in your mobile phone. So while you check your blood sugar in the glucometer, it will come into your smartphone. You can see directly in front of you what is your current blood glucose value. Now, what is interesting to note that there are few do's and don'ts while checking blood glucose through a home glucometer. There are certain things which one should remember. While you are checking your blood glucose through a glucometer, the blood should come automatically, number one. You should not squeeze the finger to draw the blood. It should be a hanging blood. You should not squeeze too much of your finger, because if you moment you squeeze your finger, it's not only your blood which is coming out, but it's an interstitial fluid that also comes into along with your blood, and this dilutes the actual plasma value or a capillary glucose value if you too much squeeze. So that's the one point one should remember. Second important point, that you when you are pricking, you should not prick at the middle of the pulp. You should do it either laterally or medially, because the nerve fiber is in the central area. So you feel less pain if you prick either on lateral or medial side of the pulp of finger, tip of your finger. So that's the second point. Third important point which one must remember, that one should be very careful in the temperature, right? Too much of temperature can change the accuracy of glucometer, so take care of that part as well. The fourth important point while testing blood glucose through glucometer is, remember that one should not keep a mobile phone near the glucometer. The glucometer and the mobile phone should have at least a distance of 2 feet, 50 centimeter away. Remember, because the electromagnetic field of the which is present inside the mobile phone as well as in your glucometer strip that can change the accuracy of glucose reading. So keep your mobile at least 2 feet away from the glucometer area. That's the fourth important point. Fifth important point, and which is vital, is don't keep open your strip for a longer period of time. Please remember that glucometer strips are kept in a dehydrated situation. So if you open the cap of a strip, the outside moisture will be captured by the strip, and then the accuracy of glucose testing would be altered. So these are 5 important points while you are measuring glucose through your capillary blood glucose. The most important part today in treating diabetes is making patient aware of what they are doing. And as I said, with the integrated personalized diabetes management, you can see your blood glucose directly on your mobile phone once you check your blood glucose through the glucometer. So this has changed the entire landscape of today's diabetes management. The second important point is that glucometer in the today's era has basically replaced laboratory testing of blood glucose. As I said, the modern glucometers are as accurate as venous blood glucose measured in the lab. There may be certain variation we call as a coefficient of variation, which differs from 1 to 4% depending upon what kind of enzymatic method is being used in different glucometer. Principally, there are 3 ways of enzymatic method. As you all know, glucose oxidase is the most commonly way how the glucometer runs through. The second methodology is a hexokinase method, and third is a dehydrogenase method. Now, all 3 are pretty accurate. There are certain do's and don'ts. For example, if somebody has got very high level of triglyceride, or somebody has got jaundice, bilirubin is pretty high, in that particular case, the glucose oxidase method can give you an error in giving accurate capillary blood glucose. Similarly, if someone is in hospital and undergoing peritoneal dialysis, or has received immunoglobulin that contains maltose or dextrose, that can interfere with technology that use dehydrogenase method. So these are some clues one should remember while checking the capillary blood glucose at home. So therefore, there are 3 kinds of error that can happen in glucometer. One is pre-analytical, which I discussed about the strip. Also important point is you must wash your finger before checking the blood glucose, because there are certain food items that can interfere in measuring your blood glucose accurately. So wash your hand. Secondly, spirit, when you are using the spirit to prick your finger, it should be totally dried, because the alcohol present in the spirit can also interfere for your capillary blood glucose testing. So this is second important point one should remember. I do not recommend my patient to use a spirit for washing. Simply wash your hand and you prick your finger to get your blood glucose. So these are some pre-analytical factors that can interfere with your glucose monitoring. In the end, I would like to conclude by saying that today, whatever treatment of diabetes has been given with the modern anti-diabetic drugs, self-monitoring of blood glucose is integral part of diabetes management. In the era of integrated personalized diabetes management with the help of glucometer getting tangled with your smartphone, you can see what is going on in terms of your blood glucose level, and one can personalize the treatment before even going consulting to the doctor. And therefore the role of self monitoring of blood glucose has got paramount importance in today's era of diabetes management. Thank you very much for your patience listening.